Back in New York, Dr. Jeske is now on lymphoma rounds with Dr. John Leonard. This morning, the team is seeing Herbert Stern, a patient with diffuse large B-cell lymphoma.
Good morning.
Good morning. How you doing?
Doctor?
Feeling okay?
Yes, I am.
Good, good. All right. Well,
just 3 weeks before, Herbert was on a ventilator, fighting for his life. Lymphoma is a type of cancer that begins in white blood cells called lymphocytes. Lymphocytes are the main part of our immune system and circulate in blood vessels, as well as in their own network of vessels and lymph nodes. From there, they can enter the blood or tissues to respond to bacteria and viruses. Lymphoma develops when lymphocytes grow and divide uncontrollably into tumors, crowding out healthy tissue and organs.
I don't feel much of anything here. These have really dramatically shrunk with the treatment, which is great. So normal lymph nodes are about 1 centimeter or so, and your lymph nodes were about 12 centimeters or so. You had, in some dimension, almost a football kind of right in here.
No wonder.
And no wonder you couldn't breathe, exactly.
Herbert is being treated with a monoclonal antibody called Rituxan. It binds only to the surface of cancer cells, tagging them for destruction by the body's own immune system. Developed for lymphoma, Rituxan is the first targeted cancer immunotherapy. And combined with lower dose chemotherapy, it is dramatically improving outcomes for many patients.
I mean, he came in and he was dying to the point that he was intubated on a ventilator, and now is almost ready to go home in a couple of weeks, which, you know, is quite remarkable. But in some cases, we're making 10, 20, 30% improvements in survival by the new treatments that we have available.
But lymphoma cases have tripled in the last 20 years. More than 500,000 Americans are living with lymphoma. As new therapies are brought to clinical trial for this and other critical diseases, patients now have more options to improve their health and to advance medical knowledge.
I think every patient should inquire as to what the opportunities are for clinical trials and to ask their doctor, is this something that they can participate in? In many cases, it can either make a big impact for others with little effort for the patient, or in some cases can really make a major impact for the patient.
My name is Sylvia. My husband, Daniel, is a physician here on staff at Cedars, and we have a little girl, now 6, who was born here, so we consider this the family business. I went in to see my internist and said, you know, I have this kind of rumbling in my stomach. I don't know what it is. You know, we eat pretty healthy, and geez, I hope I'm not pregnant again, because the little girl's only 5 months old or 4 months old, and it wouldn't be ideal timing. And he said, you know, I rarely ever see you in here, and you rarely complain of anything, and so now I'm wondering if maybe you have a gallstone. I said, I feel okay. I went hiking. You know, I had her on my back. I feel good. He said, well, let's just make sure there's nothing there. So he sent me for an ultrasound, and I was planning on not going to that test that day because I had a meeting at work. I get home that evening, and I get a phone call from my doctor. I said, yeah, hi, Stuart, how are you? And he says, well, you know, I have some interesting news. I said, what do you mean, interesting news? Well, what are we going to do? And I said, can we do surgery? Because I knew that would be the most benign, in my opinion, of the options. And he said, no, you can't do surgery for something that's metastasized. And that's another word that really hit home. Because you know once something's metastasized that your chances are much less than were it just localized. Before I knew it, the next day, they took me down to tour the cancer center area. I remember seeing all the people in the chairs, and everybody's, you know, looking pretty dour and pale and older. I thought, you know, I'm 31. Cancer happens when you're 60, 70. I went through the first regimen expecting to be finished, and was told probably I'd need another couple of cycles. And then it went to my brain. And then that started a whole another cycle of therapies given through the spine, hospitalizations, much riskier procedures. And then finally, you know, I was told your best bet is to have a transplant. I said, do people make it through that? And they said, yeah, they do. Once you know you have a disease, trust the doctor you chose. If you don't trust that doctor, you need to change. And don't try and get all the information on the drugs you're going to get. Too much information, it's not a good idea. I mean, I knew all the things that would happen, but it doesn't help me to know that. I'm just so glad to be here. I'm just so happy to be here. And there's times where you wonder, you know, why am I still here? And you kind of look to a bigger picture, and it's fate. I need to be here right now because of my little girl, and because my husband can't do ponytails.